It's class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We're located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you'd like to stop in and meet me and get a brief evaluation to share with me what's going on with you and how I can help you, it's always the best way to get the most out of the time that we would share. But with people being a little apprehensive due to COVID and who's been vaccinated, who's not been vaccinated, meeting strangers for the first time, it makes it a little difficult for people to want to meet new people, and I understand that. So the next best way would be to call me directly at area code 845-561-2225. Again, 845-561-2225. You can email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. Please don't text my phone, as it's not equipped to receive texts, and that would defeat the purpose of us communicating. I want to help you with the understandings that you need with regards to your health. Health is our birthright, and so that's why we have this free class every week. We've moved it primarily to video form so that people can get the information in the comforts of their own home. So I appreciate you tuning in. This particular week we want to talk about the fourth vitamin that human beings are aware of. It's called vitamin D. D as in dog. Getting enough but not too much vitamin D is needed to keep your body functioning well. Vitamin D helps with strong bones. It's a hormone precursor, and it helps to prevent some cancers. It's based on the research that they have out there now. Symptoms of vitamin D deficiency can include muscle weakness, pain, fatigue, and even depression. With people quarantining for the last 15 months, depression is actually on the rise, as I predicted way back in February of 2020. Vitamin D deficiency can occur for a number of reasons. It happens. If you don't consume enough of recommended levels of vitamin D, this is typically associated with people who are vegans, vegan diet, because most of the natural sources of vitamin D are animal-based, including fish and fish oils, egg yolks, fortified milk, and beef liver, believe it or not. If your sun exposure has been limited, we've been creating vitamin D deficiencies by asking people to lather up with their sunscreens and, more importantly, sunblocks. Vitamin D is manufactured when the skin is exposed to sunlight with the oils that are naturally found within the skin. And so if you're blocking that or restricting that in some way, shape, or form, you're going to develop a vitamin D deficiency. So you want to get exposure to sun. You just want to do it not at the height of sun, but earlier in the sunrise or later in the sunset. Get exposed to sunlight. That would be great. If you have dark skin, if you're dark complected, you're typically going to have a vitamin D deficiency. The pigment melanin reduces the skin's ability to make vitamin D in response to sunlight exposure. Some studies show that older adults with darker skin are at a higher risk of vitamin D deficiency. So we'd like for you to get some vitamin D. If your kidneys cannot convert vitamin D to its active form, as people age, their kidneys become less efficient, and their ability to convert vitamin D to its active form, thus increasing their vitamin D deficiency. If your digestive tract cannot absorb vitamin D, certain medical conditions, including Crohn's disease, cystic fibrosis, celiac disease, can affect your intestine's ability to absorb vitamin D from the foods that you eat. If you are obese, you have a weight management issue, vitamin D is extracted from the blood by fat cells, altering its release into the circulation. People with body mass indexes above 30% or greater have low vitamin D levels. So I guess the next question that naturally occurs is it possible, Dr. Rick, to have too much vitamin D? Actually, it is. The vitamin D levels can be lowered by certain medications. These include your laxatives, your steroids such as prednisone, cholesterol-lowering drugs, seizure control drugs, tuberculosis drugs, weight loss drugs. These are all things that can create vitamin D deficiency as a result of medications. So if you want to boost your vitamin D, what do you need to do? Well, the simple way is God made it free. Just go spend some time in the sun. Vitamin D is often referred to as a sunshine vitamin because the sun is one of the best sources of vitamin D. Consuming fatty fish and seafood, eating something that I choose not to eat, which would be more mushrooms, including egg yolks in your diet. I get at least 2 of those a day, sometimes 3 or 4 a day. Eating fortified foods that have been fortified with vitamin D, although that's really not the best way to get vitamin D. You should get it from sun exposure. Taking vitamin D supplements. That certainly is a way to offset the fact that if you live in the northern climates of the United States, you don't get enough sunlight, so therefore you might be vitamin D deficient. So Cataplex D from Standard Process is always a good source. You could try a UV lamp. UV lamps, the ultraviolets, you want to get more ultraviolet light, which will help to generate vitamin D. Top foods associated with vitamin D and calcium, because vitamin D and calcium work together. They would be spinach, kale, okra, collard greens, soybeans, white beans, some fish like sardines, salmon, perch, and rainbow trout. These are all fish that are considered good sources of vitamin D. Now appreciate, when you're exposed to the sun, your skin produces vitamin D. And we each have vitamin D receptors in the cells of our skin. And through a chain of reaction starting with the conversion of cholesterol in the skin, vitamin D is produced when they're exposed to the ultraviolet B range of the ultraviolet lights. So the question is could you ever have too much vitamin D? And the answer to that is absolutely yes. You can get hypervitaminosis D, which usually happens when you spend too much time in the sun. It results in sunburn. You'll get skin redness and blistering. What other things could you possibly get? Pain and tingling, swelling, headaches, fever and chills, nausea, dizziness, dehydration. These are all indicated symptoms of hypervitaminosis D, or better yet, known as sun poisoning. I treat at least a couple people for sun poisoning every year, and then we teach them about the counterbalance that will help to offset the problem with getting too much vitamin D, which we'll talk about in a future class, which is vitamin F. Vitamin F is what puts calcium back in the tissues so that you don't get sunburn or you don't get sun poisoning. Treating for sun poisoning would be increasing your calcium lactate, the amount of calcium that your body needs so that you have the right amount of calcium to get put back into the tissues, and then what I just mentioned, vitamin F, which takes calcium out of the blood and puts it back in the tissues. If you maintain enough calcium within your tissues, you'll never get sunburn, you'll never get sunstroke, you'll never get sun poisoning. So you want to increase your calcium lactate intake, and you want to increase your Cataplex F. These are both supplements manufactured by Standard Process. You can also get too much vitamin D and overdo your vitamin D supplements, so we definitely don't want to do that. Vitamin D toxicity is quite rare, but it can lead to hypercalcemia and other symptoms that include nausea, increased thirst and urination, poor appetite, constipation, weakness, confusion, and may get slurring of words and stumbling. That's called ataxia. So the question that's important for you, the person viewing this video, is to ask yourself a simple question. Is it possible that I have enough vitamin D? If they've done the blood work and your vitamin Ds are low and the medical doctor wants to give you a prescription form of vitamin D, I'm going to ask you to consider calling me and I'll teach you how to restore your vitamin D levels naturally. Do I have a deficiency? That would be a good thing to know. If you've already been diagnosed with a deficiency in vitamin D and you're taking some synthetic form of vitamin D, you're taking your vitamin D3, just D3 instead of all the D fractions, that would be a good thing to know, and know that you're not getting all the vitamin D that you could be getting in order to repair the situation. Last but not least, I would ask you to come in and have it checked. You spend some time with me, we could figure out, check specifically for your vitamin D, check to see if your vitamin F levels are where they should be, check to see if your calcium lactate is where it needs to be, and that's what we would want you to do. So my offer for this particular week is for you to give me a call at area code 845-561-2225, again 845-561-2225. Or you can email me at docrick@spineboy.com. That's DOCRICK@spineboy.com. Or stop into the office. If you need me to wear a mask, I'm happy to wear a mask. You don't need to wear a mask to come into my office, and we'll be happy to evaluate you and get a sense of what's going on with your vitamin D levels. And again, make sure that your calcium and your vitamin F, which we'll talk about, like I said, in a future class, those are all up to par, and your body's got all the ingredients that it needs. But with the sun being out more and more every single day, take advantage of the sun. Go out and get the one free vitamin that God created for all of us. I want to thank you for tuning in. This is Dr. Richard Untoon from Advanced Alternative Medicine Center saying, I look forward to speaking with you again when your health matters. Thanks for watching.